You get out of the hospital and the doctor says there'll be oxygen waiting for you when you get home. And you've never had it before. And you get home and here sits this big tank. And you really believe your life is over. And so you learn that there is life after oxygen.
Lung health is important because you can't replace your lungs. There's no way to improve the lungs don't get better. Lung health is important because you only have one pair of lungs.
I've essentially been healthy all my life, and it wasn't just a cough, it was more than a cough. It turned out that it was a cancer. This started back a little more than a year ago. My wife caught the cold, I caught the cold, and the problem was that my cold wasn't going away.
We were very surprised to find a very large tumor in his lungs. I would say bigger than a softball, smaller than a volleyball. So he didn't realize that because he had been healthy until his late 50s. Because we were able to finally get him to get the proper diagnostic testing, we were able to biopsy this and found out that he had a large cell lung cancer.
I just was crying because I just didn't believe it, but the other thing is that I've never been sick. But he said, you could do this. It's a long process of getting treatment, but being that we have this joint venture between Washington Hospital and UCSF, we're able to do it here in Fremont, which is very convenient. As my wife said, if it doesn't seem right, then you should go see the doctor just to see that something is not really wrong. So I want to really thank my wife for that.
Lung health affects not only patients, but their whole family. It's a team-based approach. Everyone is in support of one another to really recognize and identify the trigger factors that cause the lung disease to start with, whether it be asthma, whether it be COPD, that we can identify this early on and then start them on a treatment regimen or an action plan that the patients can actually incorporate into their daily lives. Hey, Kevin, good to see you this morning.
Thank you very much. Dr. Chu is a doctor I saw first for my pulmonary problems. At first it was just basically thought I was short of breath, having a few problems there. He gave me some tests and he says, you have pulmonary fibrosis.
Kevin was referred to me probably 5 years ago from his cardiologist because he had both a heart and lung condition. And they were holding off on trying to do the final definitive treatment for his aortic stenosis because his lung condition was starting to deteriorate.
I like to walk around the Lake Elizabeth there, and it was really great doing that, but I got less. I could do 3 laps, then I could do 2 laps, then I could do 1 lap, and now I just couldn't do it anymore. Maybe I could do a half a lap, and that's when I felt, man, I got to do something or I'm going to have an oxygen mask.
Upon reviewing many of the tests he had performed and then adding additional tests that we needed to do to finalize the diagnosis, we realized that there was a treatment option available for him. And he has continued to improve his quality of life that he hadn't been able to have for 5-6 years.
The purpose of the pulmonary rehab program is so that somebody that has a lung disease can learn some tools to have a better quality of life, so that they can do their activities of daily living, maybe learn how to use their oxygen properly, not feel nervous or have anxiety about it, know that they're using their medications correctly and why they're using their medications, why the doctor has prescribed them. But the number one thing is we want to keep them out of the hospital.
More energetic, able to get up, not taking too many naps during the day. Yeah, I feel good. I feel really good.
Lung cancer is one of the most common cancers in the United States. It's actually the #1 killer of patients with cancer.
I was diagnosed with lung cancer last May. My wife urged me to have this CT scan because she said, "Doctor, he's been smoking." And luckily, it's all covered by insurance, covered by Medicare.
So we have a new lung cancer screening program at Washington Hospital that is multidisciplinary program. So what this means is if you meet criteria for lung cancer screening, you're a person between the ages of 55 and 80, you have a heavy smoking history, you're a current smoker, or you've quit within the last 15 years, you can obtain a low-dose CT scan for lung cancer screening.
It was a good thing I had it because I had no symptoms. So they caught it early and everything's great. I'm feeling fine. life is normal. Walk the dog, get up early, watch TV, try and decide what stock to buy next.
Just that peace of mind, I think, has enabled our community to feel that we're on their side and that there are things to be done.
Better Breathers is a group of lung patients. Some of us have emphysema, some of us have asthma, some of us have just COPD. It's a group of like people with the same problems, so we all understand each other's problems. I'm extremely grateful. I think that I would have been in a much worse place in my life, in my health, had I not been involved with Better Breathers.
To learn more about preventing, diagnosing, and treating lung disease, visit BayAreaHealthierTogether.com.